There can be no such thing as the spirit of nursing without understanding. Knowledge may make of you a scientist, wisdom a sage, but understanding will make you a human being and an ideal nurse. These words greeted the first 24 nursing students when they arrived on the campus of Duke University in 1931 to begin a new 3-year diploma program. The School of Nursing opened simultaneously alongside Duke Hospital and the School of Medicine, fulfilling from the beginning the triple role of treatment, teaching, and research. The first dean of the school, Miss Bessie Baker, also served as Director of Nursing Services at the hospital, fostering a close relationship between nursing education and nursing service. Miss Baker's attention to detail and professionalism shaped the School of Nursing from the beginning. Working closely with Dean Baker, Miss Ann Henshaw Gardiner developed an innovative curriculum advocating total nursing care with attention to the emotional needs of patients as well as their physical maladies. From the earliest days, Duke nurses were being challenged to analyze individual situations and problem solve. They were taught to be thinking nurses.
A good friend of mine said to me one time, "God grant me a thinking nurse, and God save me from one who can't." And that's what Duke gave me, was the ability to think.
My brother was in the divinity school at Duke, and I was determined to be a nurse, and so one day he wrote me a letter, and he said, "Sis, if you're determined to be a nurse, go somewhere where you can get an education also." And he says, "Duke has a school of nursing that would offer you that." So I applied, and they took me. And that was the beginning of my love affair with Duke, and it's still strong, very strong.
It's very good.
Living on the Women's College section of Duke campus allowed the students a unique opportunity to augment their nursing education with liberal arts classes from other departments.
Here's the Duke School of Medicine, one of the nation's foremost. The School of Medicine, the 600-bed hospital, and the School of Nursing form an internationally known center of teaching and healing. Students in the School of Nursing receive their training both in classrooms and on the hospital wards. 3 calendar years of study lead to the diploma in nursing and the certificate of registered nurse. A 4-year program leads to the Bachelor of Science degree in nursing. In the field of medical research,
We worked 8 hours at least a day, and we went to classes on top of that.
We staffed the hospital. We really did.
And we worked 3 shifts. And you talk about hard. You work all night, and you're in charge of many patients. You come down, you have breakfast, and you go to class. And you have to stay awake. And that's hard. Even though we were young, that's hard. But we did it. And we had 3 stages of uniforms. You had your dark blue dress and your apron and a organdy bow tie. And then we got our caps. In March or February, we were capped. And we had a very beautiful ceremony to giving our caps. And then we were dressed like all the other students. We had our bibs and our cuffs and our cap.
The caps. Can you see the cap there? Kept my cap and wore my cap every day till the last day I worked at Duke.
We were very proud of our uniform. And we felt very proud to wear it.
By the mid-1940s, there was another kind of uniform being worn around campus, the cadet nurse uniform. During World War II, the number of nursing students doubled from 100 to 200. When the war was over, it became clear that the Duke University School of Nursing needed to update their program to keep in line with emerging trends in nursing. The school appointed Thelma Ingalls, and she brought with her progressive ideas about nursing and nursing education, including the idea for a master's program in clinical specialization.
At that time, to obtain a graduate degree in nursing, it was either in supervision or teaching or administration, what we termed functional levels, really, rather than clinical. And we talked about having a master's program that would provide clinical specialization.
During this same time frame, a decision was made to drop the traditional diploma program and focus on the BSN curriculum and the implementation of the clinical master's program.
That was a high mark in professional nursing because it was the first. Duke School of Nursing really is credited with being the pioneer and the developer of the clinical master's program.
Clinical innovation at a master's level continued in 1966 when Dr. Virginia Stone developed and implemented the first gerontological nursing program in the country. Curriculum offerings at both the master's and baccalaureate level continued to change and develop throughout the late 60s and 70s. In 1971, Dean Ruby Wilson established an innovative undergraduate program that offered an integrated curriculum, vastly expanding the educational and clinical opportunities available to the students.
We moved to what was called an integrated program, and the faculty stayed with their group of students throughout the semester and had clinical experiences in a variety of settings. You took students into the community, into a school, or you took students to the public health department to work with patients in the community. They were integrated in a way that was new and very challenging to teach.
The curriculum was challenging, and nursing students had rigorous demands on their time. They studied, worked, and lived together in Haynes House, the nursing dormitory built in 1952.
I moved into Haynes House in the fall of 1967 as a freshman student. At Duke, the women lived on the East Campus, and the only women who lived anyplace else were the nursing students who lived in Haynes House on the West Campus. Haynes House was the place where we went to class, where we slept. We picked up our laundry in that house. Our library was in that house. We also would sunbathe on the roof.
If somebody got pinned or a lavalier or engaged, the girls' friends very secretively would go around and put up, "There's a candlelight tonight." What I really remember about Haynes was the camaraderie. It really was a sisterhood.
By the early 80s, Haynes House Dormitory was closed, and the baccalaureate degree discontinued amidst much controversy. It was the end of an era. The School of Nursing would have to redefine itself.
You know, when I came to Duke, the school was very small. We had 5 faculty and around 57 students. And so it was clear there was tremendous opportunity. It was a great time to grow the school. We tried to be very strategic. We thought about what are the real strengths of Duke? What can we do that others can't do? And we coupled that with what are the real health care needs of people in our country.
We're actually going to be in here today. We're just going to go ahead and sit down.
And so we developed the first geriatric nurse practitioner program in North Carolina. Our program is now ranked 8th in the country, and we have a real research presence in looking at ways to improve the health care of elders.
Good morning, everyone. Good morning.
I'm currently engaged in a research project funded by the National Institutes of Health through the National Institute of Nursing Research. I have a large group of people here at Duke who are working with me from a variety of disciplines, looking at how management practice, particularly in long-term care settings, can be used to influence the care outcomes.
Following the development of the geriatric program, we turned to pediatrics. Then brought on a neonatal nurse practitioner program. We are, without a doubt, the most successful program in our state, and I might say nationally. We also have incredible research going on in caring for low birth weight infants.
The use of neonatal nurse practitioners in nurseries across the country has grown significantly in the past 10 to 15 years. And the students that we graduate have jobs waiting on them well before they graduate. I'm Debbie Brandon, and I'm a faculty member at the School of Nursing, and at the school I am the specialty director for the neonatal program. I also do research and have a NIH-funded grant and am a clinical nurse specialist in the intensive care nursery at Duke University Hospital. Clinical practice for me is where I stay grounded, because without the clinical practice I don't generate the research ideas that I think are meaningful.
We followed the neonatal program with a family nurse practitioner program. Throughout our state and nationally, there are areas, particularly rural areas, where there are underserved populations that have no access to primary care.
I'm Lori G. I'm 33 years old. I'm in the Master of Science Nursing program here at Duke School of Nursing. I'm in the Family Nurse Practitioner track. I'm very interested in the Latino population because it is growing quite a bit in North Carolina, and I like being able to be in that setting and teach people about different illnesses they have, hypertension or diabetes or whatnot, and give them the information that they need so that they can make decisions for themselves. And to me, that's what being a nurse practitioner is about.
Okay, when did it start? About this morning? I'm Ann Derwin. I'm the nurse practitioner that's here every day in the Wellness Center here at Southern High School. Let's check your ears first. The school is way out here away from any other healthcare providers. We're not near the health department. We're not near any other doctor's offices. The school needed help. The kids in the population of the school needed help. Duke School of Nursing was one of the first that I know of that had a health center back up a school-based health center.
Trying to.
I have several nurse practitioner residents who come through, usually 2 a semester, in the pediatric division of the graduate school at Duke, and then I have the accelerated BSN students come here. So we very much use it as a teaching facility.
Good job, Trevor. Much better. It's working.
From nurse practitioners to nurse anesthetist to nurse informatics, the school continued to create focused areas of study at the graduate level, targeted to prepare nurses to meet the needs of the community in and out of the hospital setting. In response to a continuing critical shortage of nurses, the school also reintroduced the undergraduate degree. The rigorous 16-month accelerated program attracts motivated students with existing bachelor's degrees and previous jobs, sometimes in healthcare, sometimes in other fields.
It has a tremendously high graduation rate, and the students are taking critically important positions upon graduation.
I'm delighted to be with you this afternoon, and I am happiest of all that I am able to compete with the sound across the street. Because that's our building.
In 2004, Duke alumna Katherine Gillis became the dean of the nursing school and brought with her a clear and ambitious vision to position Duke University School of Nursing as a leader
We are now at a place where, with a new president, with a new chancellor, with a new dean and vice chancellor in the school, a new PhD program, a new building, a new accelerated bachelor's program, that we're looking forward to a next 25 years that will be very, very different from the first 75. Similar in some ways, certainly similar in that we will continue to educate the very, very brightest people who are interested in serving as nurses.
Nursing, I feel like it was sort of a calling. It was a calling to be there. It was a calling to be able to intervene in people's lives all across the lifespan, sometimes at a time of wellness, sometimes at a time when things are not going well. Are you able to make a difference?
I am a nurse. I will always be a nurse. And I was professionally and socialized as a nurse at Duke University School of Nursing, and that will last me a lifetime.
Our shared goal should be the improvement of health for all people through the sound delivery of health care, through creating excellent outcomes for our patients, both in the hospital and in the community.